Hi, I'm Dee. It's very nice to meet you. I'm going to be your MRI technician today, okay? I spoke with your ER doctor, Dr. Veda, and we've determined that an MRI would be appropriate in your situation. Normally, for trauma patients, we do a CT scan, but because you don't appear to be in critical condition, you are in stable condition, we can honor your request to do an MRI. So, good news. I know you were worried about the radiation from the CT scan, so this should be better for you. I do have to go through a checklist with you just to make sure that the MR will be safe, okay? Let me start by confirming your name and date of birth. And what is your current height? And your weight? Oh, an estimate is fine. Okay. So, the following items may be harmful to you during your MR scan or may interfere with the MR examination. Please provide a yes or no answer for every item. So, it's whether you have this item. Okay. Cardiac pacemaker or implanted cardioverter defibrillator ICD. Okay. Internal electrodes or wires such as pacing wires, DBS, or VNS wires. Artificial heart valve, coil, filter, and or stent. Okay. An aneurysm clip or clips. A neurostimulator like a TENS unit, biostimulator, bone growth stimulator, DBS, or VNS. Okay. Implanted drug pump. External drug pump. IV access port. Implanted post-surgical hardware such as pins, rods, screws, plates, or wires. Any artificial joint or limb. Any artificial eye or eyelid spring. Any eye injury from a metal object such as metal shavings or metal slivers. Any ear or cochlear implant or middle ear implant. Hearing aids, false teeth, dentures, metallic removable metal dental work, braces or retainers. Okay. Any type of implant held in place by a magnet. Have you ever been injured by a metal object such as a shrapnel, a bullet, or a BB and required medical attention? Any medication patch like a nitroglycerin, nicotine, or estrogen. A shunt or SOFI adjustable and programmable pressure valves. A spinal fixation device, spinal fusion and or halo vest or spinal cord stimulator. Surgical clips, staples, or surgical mesh. Okay, we're almost done. Any tissue expander, radiation seeds, okay. Any body piercings, tattoos, or permanent makeup, okay. Any wig or hair implants. Excellent. Okay, yeah, the reason we ask you that is because the MRI, magnetic resonance imaging machine, uses magnets to create the image, so any of these things could interfere with the exam or be harmful to you. So, do you have any history of kidney disease, diabetes, liver disease, claustrophobia, any latex allergy, any drug allergy? Okay. And we're not going to be using the MRI contrast agent today. For your protocols that we need to do for the trauma MRI, we don't need to do the MRI contrast agent, so let's skip that section. Okay, so I'm going to go ahead and read to you some instructions. Some of these don't apply to you as you were brought in as an emergency patient, so you do not need a locker for your items. Remove all jewelry, any hair accessories, and body piercings. I know you said you don't have any. If you have any dentures, false teeth, partial denture plates, or retainers, those need to be removed. No hearing aids and no eyeglasses, so we're good there. We will help you change into a gown for this procedure. And let's see, we're going to bring you to the restroom on the way to the MRI machine so you can use the restroom. And I'm going to be giving you a pair of headphones to wear as you go into the machine, okay? I'll be able to speak to you through those, and also it will block out some of the noises from the machine. It is very loud without the headphones. It makes a lot of different noises, sort of like a printer or a construction site almost. You'll hear all manner of different noises: whirring, beeping, chirping, kind of banging or clanging. Do you have any claustrophobia? Oh, that's good. Okay. And do you find that you might be bothered by any of those loud noises as far as you can predict? Okay, yeah. And I know from your chart here that it says you do have a bit of a headache right now from the head injury, so we'll try to limit as much of that noise as possible so we don't cause you any more pain. So we have that all done. And I'm going to get you wheeled down to the MRI, and we will begin your scan. Okay. All right. Okay. So I have you lying down, pillow. Are you sort of comfortable enough? Okay. Just go ahead, and I'm gonna place your head and position it where we need it to be for the scans. Okay. In there. There we go. Okay, that looks great. So the big thing to remember during the scan is to try to stay as still as possible, all right? Because the images need to be as clear as possible for the doctor and neurologist reviewing them. If they are blurry, we might need to retake some of them. So just try to stay nice and still. I'll be giving you some cues to breathe, hold your breath, whatnot, in order to get the best images. If at any time you feel uncomfortable or sick or anything from the head injury especially, I want you to let me know as soon as possible. I want to make sure we're keeping a good eye on you because of that accident, okay? So today, like I said, we're not going to have to do the contrast agent, so no injections, nothing. Just going to put you in the machine. You're going to hear quite a few loud noises. I'll talk you through the whole thing, and we'll make sure that your scan is done as quickly as possible, okay? All right, so just try to stay nice and still and let me know if anything is uncomfortable or if you need me. I'm going to put some headphones on you now, and I will be able to hear you through the headphones I'll be wearing, and you will hear me through these, okay? So just go ahead and put these on. There we go. Perfect. So you should hear me just fine. I'm going to go back into the booth once we get you back in the machine, okay? Your tray is going to move backwards into the machine when I press the button. You ready? Okay. Oh, there. Okay, so your positioning looks really good in there. Can you hear me okay? Okay, perfect. I can hear you too. So if there's anything at any point that feels uncomfortable or you start to feel strange in any way, just let me know right away, all right? Okay. Yeah, I want to keep a good eye on you because of that accident that you had. So let me go ahead and start by pulling up your profile here. Right. And can you give me your date of birth one more time? Okay. Thank you. Okay. And can you confirm your height and weight for me? Okay. Thank you. All right. So we're going to do a total of 5 different protocol scans. They will last anywhere from 2 to potentially 15 minutes. I don't think we'll have to go that long on any one of them, but just in case. They're each looking for different things, so we're just going to make sure that all of the parts of your brain look a-okay and that we don't see any issues with blood flow or hemorrhage or anything, okay? Right, so let me get you started on that first scan. It's going to be a T1 protocol on the sagittal plane. And in this one, we're looking for slow flowing blood and any proteinaceous fluids, okay? And are you ready to start the first one? You'll have to be very still. Okay, let's get going. And starting now. Okay. Yeah, it's pretty loud, but the headphones should hopefully block most of that for you. And luckily, you said you were not claustrophobic, so hopefully you're doing okay in there. Just keep nice and still. You're doing a great job. Okay. So basically, this scan measures the T1 relaxation time in the tissues of your brain. So after the magnet demagnetizes, not all tissues move back into equilibrium at the same time. So T1 reflects the amount of time it takes for protons to realign. Yeah, pretty complex. So the fat realigns more quickly, so it looks brighter on the scan. And water and other fluids realign slowly, so they'll look dark. So it just shows us what the fat and fluids look like in your brain, and the flow of those fluids such as blood. Okay. You're doing an awesome job so far. Okay. In a moment, I'm going to ask you to hold your breath as best you can. It won't be for long, probably about 5 seconds, okay? Can you take just a nice breath and hold? Breathe and hold. 1, 2, 3, 4, 5. And you can breathe like normal. Thank you. Sometimes when I ask you to hold your breath or potentially blink, it's so that we can hold everything in one place and get a good scan. Okay. That's looking really, really good so far. We just want to make sure that all of your scans are very clear so that your neurologist and the ER doctor can get a good evaluation of your brain. Okay. Yeah, you're doing an awesome job. I know that today must have been very, very stressful for you. Okay. Now I'm going to ask you to do a series of slow blinks. So, slow blink like a cat. You may start 1, slow blink, 2, 3, 4, 5. Okay, very good. And if you can just try to maintain a nice, deep, calming breathing, okay? Without moving, of course. You're doing awesome so far. Okay. Alright. That is looking really good so far. Okay. Yeah, T1 on the sagittal plane. Alright. And when we're done with all of these, I believe Dr. Veda in the ER is going to take a look, as well as doing a quick consult with one of our neurologists before we send you home, assuming that everything checks out. Okay. Alright, I'm going to have you hold your breath again in 3. 1, 2, 3, and hold. 1, 2, 3, 4, 5. Okay, and now you can breathe normal. Alright. We are almost done on this first scan. Okay, Just about 20 more seconds, I'd say. Okay. And very good job maintaining that same position, staying nice and still. Okay, yeah, I can see you. Alright, about 10 more seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. Perfect. Okay. Now that one's over. I know those last ones were kind of like workout seconds. Alright. So that scan looks good. Waiting for the rest of it to render. Just take a couple more seconds and I can make sure that all looks nice and clear. We just don't want anything to look blurry. Okay, beautiful. That looks really good. Okay, so your second scan is going to be a T2 scan on the axial plane. We're checking for consistency in blood flow, any hemorrhage, or potential cysts, okay? And are you ready to start the next scan? Perfect. All right. Nice and still. Starting now. Okay. Very good. Yeah, I was saying before, workout seconds, you know, like if you have somebody counting down your seconds, I don't know if you ever do any like video workouts or work with a trainer, they'll say, oh, just 10 more seconds, and they're the longest 10 seconds of your life. I don't know what kind of watch they're using, but it's definitely not the same as mine. Okay. So right now we're measuring the T2 relaxation time in tissues. So just like the first one, but on this one, the fat is going to look intermediate bright and the fluid will look bright. So fluid is actually going to look brighter than fat on this one. Okay. And this is a pretty quick one, so you won't be stuck too long, and only 4 more after this, so you're doing a fantastic job. Okay. Yeah, like I said before, we don't typically do an MRI for trauma patients. We would do a CT scan first, but since you're very concerned about the radiation, we definitely can do the MRI. It should uncover any issues. It's actually better for certain things, but usually we do the CT because it's faster and better for those that might be in unstable condition, but you seemed stable enough to undergo the MRI. You seem good now, so. Okay, and again, I'm going to ask you to hold your breath on the count of 3. 1, 2, 3. Hold, 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 and you can release and breathe like normal. All right. Looking very good so far. Not much time left on this one. Okay. Excellent. Alright. Just taking a look at these scans. They are coming up really nice and clear. You're doing a very good job holding still. Just maintain that position. Okay. Lovely. And we're going to do a couple blinks again. Blink and blink and blink. Very good. Okay. And we're almost done with this one. Just a couple more seconds. And okay, done. Perfect. All right. So those are rendering. The initial ones looked really nice and clear. Occasionally we'll have to redo a protocol things don't look clear enough, we just want to make sure we get the best images possible for the doctor and neurologist. Okay, so rendering, and they look good. Awesome. Okay, so before we move on to the next one, I just want to check in with you. Does everything feel okay? Okay, and you're comfortable still? Yep. Any new symptoms? Have you been experiencing nausea in the last few minutes or any dizziness? Okay. And are the sounds bothering you too much? No. Okay, good. Yeah. Oh, I know you said you had a headache too, so I definitely want to block out as many of the loud sounds as possible. Okay. Alright, so now I'm going to be starting a FLAIR sequence on the axial plane. And this one will detect subtle changes in the periphery of the hemispheres. Okay. And starting in 3, 2, 1, go. Okay. So basically we're looking for reduced blood flow in any CSF leak. The CSF is that cerebrospinal fluid. They also checked your ears for that before because sometimes that can be a sign of a brain injury. If you have a CSF leak at all, we don't want to see that. So, very good. Yeah, the MRI can detect some of the most serious things, like any sort of hemorrhage, issues with blood flow, CSF leak, stuff like that. But it doesn't definitively tell us if you have a concussion. That can't be seen on an MRI or a CT. So basically we look at the symptoms for that, and I know Dr. Veda talked to you a little bit about a concussion due to your symptoms, but you'll be getting some more info on that when you go back to the ER. Okay. This looks good so far. You're doing an awesome job. Nice and still. So the FLAIR is basically an inversion recovery sequence. It removes the CSF in the resulting images. So your brain tissue is going to look the same as it does on the T2 scan, but your fluid is going to look dark instead of bright because it removes that CSF from the image, leaving it dark. Okay. You're doing an awesome job. Yes, this can be very stressful too. A lot of people are really nervous when it comes to MRIs because of the enclosed space, so we were in luck that claustrophobia is not an issue for you, but even without, it can still be pretty overwhelming with all of the noises and everything going on, but it is very safe, and you're doing a great job. Okay, I'm just gonna have you breathe with me for a moment. Nice deep breath in and out, and in and out. Very good. And on this next one in, I'm going to have you hold your breath in and hold and hold and hold and exhale. All right. That's lovely. Okay. Yeah, I think the hardest part for me with an MRI would be just having to stay so still. You're doing a really good job. It's like if I feel like I can't move, then I almost need to move more. I hope I'm not making you feel like you need to move. We're almost done with this one, and then if you need a break, we can take one, or we can knock out the last two. Okay. Wonderful job. Right. Very good. Scans look really good. I can see them as they come through, but then you get a clearer image at the very end. They all have a chance to render. Okay, about 20 more seconds again. Maybe workout seconds, depending on how fast it finishes up at the end. 10, 9, 8, 7, 6, 5, 4, oh, and it's done. Okay. Excellent. So you only have 2 more. Are you doing okay in there? Okay. Do you feel the need to move at all, readjust? Okay. Yeah, if you just need to move your head just a tiny bit, just try to go back to the position you were in. Okay. Yeah, that looks good. That looks good enough. As long as you're not moving during the scan, we are okay. We just want it to be clear. All right. Time for the last 2. You ready for the next one? Okay. So this one is a DWI, diffusion weighted imaging, and it detects cerebral ischemia, ischemic stroke, which results from blood not reaching parts of the brain. It also detects certain types of lesions. Okay, starting now. Right. Here we go. Okay. I've had kind of a slow day today. We haven't had as many appointments scheduled as usual for the MRIs, so I'm glad because we were able to get you in right away and not do the CT. Yeah, we try to honor the requests if we're able to, but if we find that we just can't do the MRI and the CT is the only one available and you're at any sort of risk, we would try to do the CT. Of course, we can't do it without your consent, but I'm glad we were able to do the MRI. I can understand if it's something you're more comfortable with. Okay. So this scan measures the random Brownian motion of water molecules. Regions with cellular swelling, so fluid, or trauma, will exhibit lower diffusion coefficients. So that's why it's diffusion weighted imaging. Looking at those images for diffusion coefficients. Okay. Very good. You're doing an awesome job staying still and staying calm. Yeah, I'm glad we didn't have to do the contrast. It's really not a big deal to have it, but I think with everything going on for you right now, if we don't have to poke you with a needle, and sometimes you can experience a little bit of a flush and metallic taste from that gadolinium contrast solution. So also it takes less time if we don't have to use that, so that's good. Yeah, we don't use the contrast solution for most trauma related scans. It's not necessary for the protocols we do. Okay. Alright, and you know the routine. I'm gonna have you take a nice deep breath with me. In and out. And hold on this next one. In and hold. And hold. Hold. And release. And you can breathe normally. Looking good so far. Okay. Yeah, I don't give you your results Dr. Veda will give the results to you. That'll be pretty quick. I know they're going to look at your scan right when we're done, so you won't have to wait. Okay. Very good. Okay, and we're almost done here. This one finished up pretty quick. 4, 3, 2, 1. And done. Okay. Still feeling okay? Good. And no dizziness, no nausea beyond what you had before we started? Okay, very good. And nothing has changed or gotten worse? Good. Okay. Yep. Just keeping an eye on you. And just one more scan. Alright. This one is the SWI susceptibility weighted imaging. It will detect hemorrhage, any blood products, or calcium that may not show up on the other MRI sequences we've done. Getting tongue-tied here. And are you ready to start the very last one? Okay. And starting now. Okay. You have been an absolute champ during this process. Probably only about 3 to 4 minutes left, and then we will get you out of that machine and back over to the ER so that you can get your results and hopefully go home. If not, then we will take good care of you. You're doing so well. Okay. So this one, basically compounds in the brain that have paramagnetic, diamagnetic, or ferromagnetic properties interact with the magnetic field of the MRI, and it causes distortion and a loss of signal for the image. So that's how we're detecting these deposits. Okay. You know, by the magnetic compounds in the blood or calcium distorting the image. Okay. Looking very good. About a minute and a half, probably. And we're gonna do some nice blinks. Okay, blink. Slow blink. Blink. And blink. And can you close your eyes for me for a moment? Just close your eyes. Keep them closed, nice and still. And you may open and blink as normal. Okay. Very good. Less than a minute left. Very good. Okay. Because sometimes with the MRI, we can and do we can and do a what's it called, sedative, if somebody feels extremely anxious or just can't make it through because of claustrophobia or other anxiety, and they can't stay still. You can use a sedative, but that would not have been a good choice for you right now anyway, due to the trauma. So I'm very pleased at how your scans are coming out. You're doing an awesome job. Okay. And we are done. Excellent. Okay. So I'm going to come back around and get you out of the machine. We will get you back to the ER, and you should be getting your results very, very quickly. Dr. Veda will handle it from here and be able to answer any of your questions, okay? Okay, you did fabulous job. All right, I'm just going to come get you. All right. Okay, so I have had a chance to review your MRI results, and everything looks perfectly healthy and fine. No injury was identified on the scan, so we didn't see any abnormal bleeding or fluid leakage, no signs of hemorrhage or anything like that. Now, that does not mean that you don't have a concussion, however. So, a concussion would not be detected on either an MRI or a CT. So, that is still very likely with the symptoms you're experiencing. I'm going to send you home with this concussion aftercare sheet. And with your permission, I can also give a copy to your emergency contact. Okay. So this just basically says you've been examined for a head injury and possible concussion. You had an MRI scan, and I've changed that from CT scan, and no injury was identified. It is safe for you to go home, but you may still have had an injury to your brain or may experience symptoms. We suggest that you limit certain activities, such as working out, driving, anything that is strenuous. Take time off from work or school for 2 days until you and your healthcare professional think you're able to return to your usual routine. So if you feel much better, then it is probably safe if you have a mostly sedentary job, but I recommend 2 days off. Okay. There are some signs that you need to return to the emergency department, however. So if you experience repeated vomiting, a headache that gets worse or will not go away, loss of consciousness or inability to stay awake during normal waking times, more confusion, restlessness, or agitation than usual, any convulsions or seizures, of course, any difficulty walking or issues with balance, weakness or numbness, or difficulty with your vision, including blurred or double vision, okay? So those are signs that a serious problem could develop and you may need to return to the emergency department. Okay. This also has some information about what a concussion actually is. What should you expect once you're home from the hospital? Generally, most people recover quickly and fully. However, there are a range of symptoms that can be experienced, and some people may experience symptoms for several weeks, even months. Some symptoms may not appear for hours or even days after the concussion. However, if things appear to be minor and are not on the list I read to you before, you most likely do not have to return to the emergency department. Some things you may feel, or things that you may experience, are difficulty thinking clearly, feeling slowed down, difficulty concentrating, headache or dizziness, some balance problems, irritability, more emotional. You may have issues with sleep, such as sleeping more or less than usual. A lot of these things are normal, but in the extreme would need to be examined immediately. So those are called post-concussive symptoms, and they're signs of the normal healing process. So most of the time, those aren't a sign for concern, but if they do appear to be extreme or interfering with your life, then come back in. So in order to get better, you just need plenty of sleep, rest, that helps the brain heal. Don't try to do too much too fast. Like I said, try to take the next couple of days off. Give yourself some time. If you do not feel back to normal within a week, you would likely need to see a healthcare professional who has experienced testing and treating brain injuries, such as a neurologist, and we'd be able to get you in to see a neurologist at the hospital if necessary. Sports and recreational activities, I would stay away from those for at least a week until you are feeling almost 100% or 100% better. So I will send you home with this informational sheet. You can also check with your primary care physician, but like I said, if you experience any of those serious symptoms, do not delay, come back to the ER, okay? All right. So I'm very happy at the results of your MRI, so that's good. For the head wound, that you should probably be able to move the dressing as soon as tomorrow and just use a regular band-aid or bandage. That will heal pretty quickly. We did not need to do stitches because it was a very minor superficial cut, and you can just apply Neosporin or anything on that. Okay? Do you have any questions for me? Okay. Yeah, you can take Tylenol, just the normal amount, up to 800 milligrams. So you can take Tylenol. You could take, yeah, aspirin is fine, or acetaminophen. Yeah, for the headache. If it does get worse, that would be time to seek medical help. Okay. All right. So I will give a copy to your emergency contact, and this one is for you. So I will put this with your stuff. And if you don't have any more questions, you will be discharged. I'm going to go ahead and write up your discharge paperwork, and a nurse will be in to escort you out, okay? All right, well, I certainly hope you feel better very soon, and I am so sorry for what you've been through today, but I'm glad we were able to do the MRI and make sure that there's nothing serious that appears to be happening, okay? All right. Well, I hope I don't see you anytime soon as I work in the ER, but I do hope that you feel better quickly.